Lesson 4. Breathe Easy. Navigating Respiratory Devices in the NICU. While prematurity is one of the main reasons why babies are admitted to the NICU, breathing issues can affect any newborn, regardless of their gestational age. It is important to understand how your baby's lungs work in order to better understand the condition and the methods used to support their breathing. In this lesson, we will focus on how a baby's lungs function both inside and outside the womb, as well as various ways the NICU can support your baby's respiratory health. As we learned in Lesson 1, a baby's lungs are one of the last organs to fully develop during pregnancy. This is because their lungs are not used to breathe while in the womb. However, babies do practice breathing movements in preparation for life outside the womb. Once your baby is born, their first breath is a crucial moment as it helps clear out amniotic fluid in their lungs and open up their lungs fully. Crying is a natural way for the baby to take their first breath, but sometimes babies can struggle to breathe on their own, and a call is made to the NICU for assistance during this initial stabilization period. Respiratory interventions. The NICU provides a range of interventions to support your baby's respiratory issues. This may include oxygen therapy by nasal cannula, vapotherm, high flow nasal cannula, CPAP, or bubble CPAP, mechanical ventilation, intubation with a breathing tube, or surfactant. The NICU team will carefully monitor your baby's breathing and provide treatment tailored to their specific needs. Nasal cannula. One of the options your healthcare provider may suggest is a nasal cannula. This device consists of two tiny prongs that are inserted to your baby's nostrils and are connected to a tube that delivers a small flow of oxygen to your baby's lungs. The flow of oxygen is also humidified to keep your baby's nostrils moist and prevent breakdown, such as dry nostril passages that can cause bleeding. One of the benefits of a nasal cannula is that it is a very comfortable and gentle device. Your baby will hardly feel the prongs in their nose and will likely be able to breathe normally. Additionally, healthcare providers can adjust the amount of oxygen that your baby receives through the cannula to provide them with the exact level of support they need. Vapotherm or high flow nasal cannula. Although a nasal cannula is a great way to provide respiratory support to a baby, it does have its limitations on the amount of flow it can provide. The flow of air is necessary to keep the baby's lungs open, and if they need more support, your healthcare provider may recommend a high flow nasal cannula or vapotherm. Both the high flow nasal cannula and vapotherm devices are similar in appearance to the standard nasal cannula, with two prongs that are inserted into your baby's nostrils and humidity to protect their nasal passages. However, they are designed to deliver a higher flow of air to your baby's lungs, which can help keep their airways open and improve their breathing. CPAP or bubble CPAP. If your baby needs more respiratory support than a high flow nasal cannula or vapotherm, the next step may be CPAP or bubble CPAP. These modes of respiratory support provide a set amount of pressure delivered to your baby every time they take a breath on their own. CPAP and bubble CPAP are respiratory support devices usually used in the NICU. They consist of small prongs that rest inside your baby's nose or a gentle mask that covers their nose. The purpose of these devices is to deliver a continuous flow of air and provide mild pressure to help keep your baby's airways open. In bubble CPAP, this pressure is generated by creating gentle bubbles in water or acetic acid solution. The bubble action aids in delivering the pressure through the tubing and into your baby's airways via the prongs. Depending on your hospital, a ventilator can be set to deliver pressure directly through the prongs and into the nasal cannula. This method of respiratory support is very common in the NICU, and your baby will be very comfortable while they adapt to life outside the womb. Your healthcare team will monitor your baby closely and adjust the pressure and settings as needed to provide the appropriate level of support. Mechanical ventilation, or intubated with a breathing tube. Mechanical ventilation becomes necessary when your baby requires more intensive respiratory support. In such cases, a breathing tube is inserted into the trachea and a ventilator is used to deliver assisted breaths. The ventilator is connected to the breathing tube and provides high efficient breaths to support your baby's breathing. It has the capability to inflate your baby's lungs, ensuring optimal capacity for oxygenation. The medical team can adjust various settings on the ventilator to meet your baby's specific respiratory needs. By carefully adjusting settings such as breathing rate, oxygen concentration, and pressure levels, the medical team can customize the ventilator support to suit your baby's condition. This allows them to optimize the delivery of oxygen and ensure your baby is receiving the necessary assistance for their breathing. As a parent, you may be concerned about how your baby is responding to the respiratory support. The medical team caring for your baby will closely monitor their progress by watching their oxygen saturation levels and their work of breathing. They will draw lab work to see how your baby is responding to the ventilator. In the NICU, there are different kinds of ventilators that may be used to provide your baby with the most appropriate care while they're intubated. These ventilators include conventional ventilators, high frequency oscillators, and high frequency jet ventilators. Each of these ventilators works with a breathing tube and provides different capabilities to help your baby get the support they need. A conventional ventilator is used to provide additional support for a baby's breathing. It delivers controlled breaths to their lungs through a small breathing tube, supplying them with oxygen rich air. The ventilator settings, such as the breath rate, number of breaths per minute, tidal volume, the amount of air with each breath, and oxygen concentration, are customized by the medical team to meet the specific needs for the baby. Through the process, the doctors closely monitor the baby's progress and safety through alarms and regular assessments. As the baby improves, the level of ventilator support is gradually reduced, allowing them to breathe more independently. The medical team carefully adjusts the ventilator settings accordingly. The main goal is to provide optimal respiratory assistance while encouraging the baby's progress toward breathing on their own. When a baby is not responding well to a conventional ventilator, a doctor may order them to be placed on a high frequency oscillator ventilator, commonly called an oscillator. The oscillator works differently from a conventional ventilator. It delivers small and rapid breaths to a baby's lungs, providing about 900 breaths per minute. The oscillator not only delivers the breath quickly, it also withdraws it rapidly. This approach ensures that the breaths are gentle on the baby's lungs, promoting better oxygenation and allowing the baby's lungs to rest, heal, and grow. Another mode of ventilation in the NICU is high frequency jet ventilation, commonly called the jet ventilator. It is similar to the oscillator, but is considered slightly more gentle. The jet ventilator delivers rapid breaths, typically around 200 to 400 breaths per minute, with a slightly larger volume of breaths compared to the oscillator. Unlike the oscillator, the jet ventilator does not actively pull out breaths. Instead, it briefly pauses for a few tenths of a second between breaths, allowing the baby's body to passively exhale the breath. The jet ventilator is commonly used as a rescue ventilator and is considered one of the highest levels of support that can be provided in the NICU. It offers an alternative approach to deliver respiratory support for babies who may not respond well to other modes of ventilation. While it can be difficult to see your baby with a breathing tube, rest assured that the medical team is doing everything they can to ensure your baby is receiving the best possible care. If you have any questions or concerns, don't hesitate to talk to your medical team. They are there to support you and your baby during this difficult time. Surfactant. Surfactant is a substance that is naturally produced by the lungs. It helps to open up your baby's lungs, making it easier for your baby to take in oxygen. However, some term babies and especially premature babies do not have enough of this substance and can lead to breathing difficulties. If a baby could significantly benefit from surfactant, the medical team will administer it to the baby in need. To administer surfactant, the medical team will insert a breathing tube into your baby's airway. This procedure is typically done by a neonatologist, nurse practitioner, or respiratory therapist who has specialized training in working with newborns. An X-ray is taken to ensure the breathing tube is in the correct position. Once the breathing tube is securely in place, the surfactant medication is administered through it. The medication helps improve functioning in your baby's lungs, making it easier for them to breathe. The medical team will closely monitor your baby's respiratory status during this time. Depending if your baby's breathing greatly improves, the breathing tube may be removed once the medication has been administered. If your baby takes time to respond to the medication or potentially requires another dose of surfactant, The breathing tube may be left in place to provide your baby with additional support as they recover. In either case, the medical team will continue to monitor your baby's breathing and provide the necessary interventions to ensure their comfort and safety. It is important to remember that administering surfactant is a common and safe procedure that can help your baby breathe more easily. While it can be stressful to see your newborn going through this medical intervention, the goal is to provide them with the best possible care and support as they continue to grow and develop. During this lesson, we have learned about the different methods of breathing support that can be provided to babies in the NICU. It is important to note that every baby is unique and the response to their treatment may vary. Therefore, it is crucial to monitor their vital signs, perform assessments, and conduct lab work if necessary to determine their progress. As parents, it can be challenging to see your baby in need of breathing support, but it's important to remember that your baby is in the best hands of the NICU team. Thank you for joining me for this lesson. I hope you find this material helpful, and I look forward to continuing our journey through NICU baby basics.